Assalamu alaikum. The eighth session of Health and Disease in Population is about causality, cause or merely association. Lecture objectives. We should be able to know about, first, explain what is meant by cause-effect relationship in epidemiological contexts. Second, recognize that associations may be present in the absence of a true cause-effect relationship. Third, evaluate the strength of evidence in favor of a cause-effect relationship. And fourth, describe how to distinguish causal from non-causal associations. Causality. What's meant by cause and effect relationship? A cause is a factor, characteristic, behavior, or event that influences the occurrence of disease or effect. معناها هو عامل أو خاصية أو تصرف أو حدث يؤثر في حدوث المرض أو التأثير. And to explain this cause and effect relationship, there is Henry Koch postulate in 1882, which is mentioned in previous sessions, and we mention its negative and positive in epidemiological context to explain cause-effect relationship. There are four types of causal relationship. First, necessarily insufficient, necessary but not sufficient, sufficient but not necessary, neither sufficient nor necessary. First, necessary and sufficient. Without that factor, the disease never develops. Factor is necessary for development of the disease, and the presence of that factor, the disease always develops. The factor is sufficient. This situation is rarely occurs. Example of that, measles. The measles virus is necessary and sufficient for development of measles and its outbreak. Necessary but not sufficient. Each factor is necessary but not sufficient to cause the disease. Thus, multiple factors are required. Example, in tuberculosis, TB is necessary. TB bacilli is necessary for the development of the disease, but not sufficient. Not TB bacilli alone will cause the disease. It needs many factors and multiple factors to cause the tuberculosis. Example, malnutrition, poor immunity, poor living condition with the presence of TB bacilli will cause tuberculosis. Third, sufficient but not necessary. The factor alone can produce the disease without other factor, so it is sufficient. For example, radiation exposure can alone produce leukemia, so it is sufficient to cause leukemia. And leukemia can occur without radiation exposure, so it is not necessary. Leukemia may be developed after exposure to benzene, after exposure to radon gas, and so on, or after smoking. Fourth, neither sufficient nor necessary. Most accurately represented in the causal relationships that develop in most chronic disease. Example, in malnutrition, in diabetes mellitus, or in poor immunity will develop another chronic disease like chronic infection like TB. The diabetes alone will not cause the tuberculosis. So it is not sufficient and not necessary. there is multiple factors to cause the tuberculosis. Evaluation of epidemiological association. An epidemiological association between cause and effect relationship, there may be apparent association or true association. This apparent association can result from chance or bias or confounding variables or reverse causality. To confirm any cause-effect relationship or association, there must be an observed association. This observed association either come from ecological study like a cross-sectional study or from clinical observations. We must ask ourselves about, is this association is due to apparent association or it is a true association. So we first should exclude causes of apparent association, mean artificial association, like is this association is due to selection or measurement bias? If no, we should ask, is this association is due to confounding like age and sex? If no, we should ask ourselves, is this association is a result from chance, by chance? So we should estimate the p-value and confidence interval to know whether this association is due to chance or not. If not, so we know that this association is a true association. The next question is, this true association is due to a causal association or not? To know this answer, we should apply guidelines and make a judgment. So, to answer these questions, we must know and remember what's the meaning of chance. Chance can be excluded by statistical tests through measuring p-value to test the hypothesis and by estimating the 95% confidence interval. Bias is deviation of results or inferences from the truth. It is raised during process of collection, analysis, interpretation, publication, or review of data that are different from the truth. The bias يعني انحراف من الحقيقة. هذا شو وقت يظهر لنا؟ أما أثناء جمع المعلومات أو أثناء تحليلها أو التعليق حولها أو أثناء النشر أو ريفيو مراجعة المعلومات. وهذا كله راح يحرف المعلومة عن الحقيقة. Example of bias: selection bias، انحراف بالاختيار الفئة سواء كانت بالكيسز أو control أو exposed or non-exposed. Second example is information bias. Example of information bias is recall bias. ما يتذكر بعض المعلومات وما يتذكر الباقي. أو مثلا عادة الكيسز يذكرون الانفورميشن ريكول بايس أكثر من الكنترول، لأن هو ما يعاني من المرض فما راح يتذكر تفاصيل exposure. Confounder: a situation in which a measure of the effect of an exposure or a risk factor lead to the outcome is distorted because of the association of the exposure with the other factors that influences the outcome under the study. Example Alcohol consumption, which is always associated with confounder like cigarette smoking, which lead to and affect the lung cancer, and it is the main cause of lung cancer rather than alcohol consumption. هنا يعني confounder هو عامل مربك، واحنا دائما سبق لنا الذكر بconfounder مثل age and sex. Reverse causality. It is sometimes possible that the cause-effect relationship exists in the opposite direction. يعني تكون العلاقة هنا عكسية، بدل ما يكون الكوز هو مسبب للإفكت، يكون الإفكت اللي احنا قاعدين ندرسه هو المسبب للكوز. Example of that, working in bars and alcohol drinking. يعني يتصورون بأن هو بسبب عمله في البار هو راح يسبب له بأن يكون يتناول الكحول، لكن هناك فرضية أخرى بأن بسبب أنه يشرب أو يتناول الكحول هو عمل في البار. To confirm cause-effect relationship and association, there is another postulate which is Bradford-Hill's criteria to judge the causal significance of the association between the factors, attributes, or of events and the effect or outcome or disease. These criteria are: first, strength of association, consistency of association, specificity, time sequence, coherence of theory, biological gradients or dose response, plausibility, experiment or reversibility, and lastly, analogy. What's the meaning of strength of association? The relative risk or incidence rate ratio is the most direct measure of strength of association. A strong association is less likely to be the result of error. وكل ما يزيد relative risk أو يزيد odds ratio أو يزيد incidence rate ratio، كل ما يزيد strength of association. Consistency. This term refers to whether the association between the agent and the health effect has been observed by different persons in different places, different circumstances, and different times. This means of consistency. Specificity if the association is limited to specific exposure and to particular disease, mean one-to-one relationship, one cause lead to one effect, one exposure lead to one disease, with no other association between the exposure and other types of disease, and this is rare. Fourth, time sequence or named temporal sequences. Exposure preceding occurrence of disease to exclude reverse causation or reverse causality. The shorter the duration between exposure to the agent and development of the disease, more certain is the causal effect. There must be a latent period between the exposure and the disease. And the shorter latent period, the better causal effect relationship. Example, acute infectious disease and chemical poisoning. Coherence of explanation. The association must be supported with what is known about the natural history and the biology of the disease. Example, association between tobacco and lung cancer is coherent with experimentally known about the ability of tobacco extract to cause skin cancer in mice. Dose response and named biological gradient. Changes in the intensity of the exposure result in change in the severity of the risk of the outcome. كل ما أزيد الدوز كل ما أزيد الريسبونس أو أزيد الأوتكم. أزيد الإكسبوجر intensity of the exposure راح أزيد severity of the disease. The dose response relationship is also measured using the relative risk. Biological plausibility. There is a potential biological history or biological mechanism which explains this association. Example, smoking with lung cancer. Smoking will lead to ingestion of chemicals and non-carcinogens which will cause DNA mutation and may cause lung cancer. Experiment or reversibility. An association in which removal or prevention of the risk factor lead to reduce or non-extent risk of acquiring the outcome is highly likely to be causal. يعني إذا منعنا الكوز منعنا الريسك فاكتور راح يقل أو يمنع عندنا الديزيز أو الأوتكم. This is probably the strongest criterion for the causal link, but is often the most difficult to demonstrate. وهذا أهم عامل لكن صعب تحقيقه أو صعب توضيحه. Analogy, an association for which there is a biologically plausible mechanism is more likely to be causal. However, analogies are a weak argument for the association to be causal. Example, the association between thalidomide and congenital malformation. In summary, most diseases are multifactorial and one exposure is not sufficient. Second, one exposure can cause several diseases. An apparent association may result from chance, bias, confounder, and or reverse causality. And lastly, Bradford Hill's criteria is used to judge the causal association between the cause and an effect. Thank you.